Hi everyone, I'm Heather Bouchard, and today I have the pleasure of speaking with Dr. Todd Caze. He is a fellowship trained sports neuropsychologist and one of the first to complete a two-year fellowship in 2-year sports medicine fellowship in pediatric concussion. Dr. Caze is passionate about increasing access to specialty concussion care in order to get students back to the classroom and on the field as soon as possible. He does this through his clinic in Omaha, Nebraska, called the Caze Concussion Institute. Dr. Caze will be speaking at the upcoming SNS Symposium in Philadelphia this May. He will be giving a talk titled Concussion Through a Socio-Cultural Lens. Dr. Caze, thanks for speaking with me today. Can you tell me a little bit about how you use a sociocultural lens in your current practice?
Yeah, absolutely. And I'll try to be as concise as possible with that matzo ball question. So the main thing is we have to take a step back and kind of consider that historically, um, we underutilize or appreciate the importance of sociocultural factors in psychology. Now, interestingly enough, when you look at the field of psychology and how it first started, the notion of kind of a second psychology or Volcker psychology was intimately tied with what we know today as our current psychology, and there was kind of a deep appreciation that the experimental psychology side means nothing without the cultural side, without the Volcker psychology side of things. And so, as far as what that looks like for me, is a few things. So, one is it's being passionate about access to clinic. And so, most of what we do is virtual. It's about building relationships with youth organizations who maybe don't have some sort of healthcare professional that's readily accessible. It's about going to schools or organizations that historically have been marginalized. So in Omaha, things are very segregated. So I work with the quote unquote, historically Black school and cover sidelines there. And then it's about understanding that there's a real opportunity to use concussion as an agency of change as far as kind of debunking what people know about concussion, but then also providing kind of health literacy that you're entitled to specialty care, and specialty care is a good thing, and that gets really dicey because historically, if you've been minoritized, there's a book called medical apartheid. Medicine has not been kind and has treated those who are not of the majority more as specimens and lab rats. And so, we have to appreciate that there's a long history of not trusting providers. And so it's for me, it's a lot about doing community work, having that lens of what can we be doing differently. We had an advisory board for our first year with people all across the country, different specialties, and really they were addressing our values consistent with what we are, our initial strategic planning and steps that we're taking to do that. And then the other thing is that part of why we're an institute, not a clinic, is because of that educational piece and that advocacy piece. That we it's not about just transactional providing clinical care, but also we want to be infused in the community, and we want to be an agency of change.
What advice would you give for someone who wants to start making some of those bridges with community members in their own practice?
And the number one thing is humility. Just being open to the fact that you can learn from someone. I think where a lot of times we get misguided in education is we put a holy grail on those who have gone down a particular path, and somehow we weight their knowledge as more important. And the reality is that there's learning opportunities everywhere with anyone, and having that humility is important, and understanding that what you think the person needs is not maybe what they actually need. And so learning to truly listen. It's interesting. We're empathic, or we're taught to be empathic as psychologists when we're with a client. But when we're building relationships from a community standpoint or doing research, we're too quick to, well, we're going to do this, or we have our confirmation bias of what should happen instead of just truly learning. And then the other thing is just being okay with really being in the community, and it might not look the way that you anticipated that it would look. And the community, if you are open enough, will let you know if you're a part of it or not. And just kind of being aware of what those signs and signals may be.
Can you tell me a little bit more about kind of those shifts that you've seen since moving back to Nebraska and kind of what you expected and how it looks now?
Yeah, I mean, I think that the biggest thing is the language of what is most important. It's easy to, especially if you just do one injury all day, every day, to have kind of a canned spiel. And well, that may not matter based on the person that you're across from. And so, having different heuristics, and then, paying attention to cues to pivot, is because maybe my heuristic is off or my assumption is wrong. And then just being like truly creating space for, like, what are other questions that you have, and not trying to rush that, but being open minded, but yet also not feeding anxiety around the injury. So it's a delicate balance, and a lot of it is, the main thing is, like anything else, is constant consultation. Like you constantly are consulting. And where I would say it's shifted is my consultation is probably less from people in the field and more from the field being, other sports neuropsychologists or neuropsychologists, and more from members of the community or members from a different field, because they're further along in their sophistication of diversity and being socially responsive.
Can you give me an example of that?
So, I mean, one example is just covering sidelines for the historically Black school. It was realizing that me being there wasn't enough. The athletic trainer talking about the importance of concussion wasn't enough. Where we actually got buy-in is educating the coaches and the individual position coaches. And so then when a kid had one, them emphasizing the importance, the value of randomly just showing up to practice. Like, hey, it's not just a transaction. You're not just showing up on game day. You're showing up to practices. You're showing up to their spring game. You're showing up to their other events, because a lot of times they play other sports, and really, like, hey, like, I value you as a student at the school, and I value your school as a whole. That was one example of a shift, so to speak.
You mentioned a couple of things. One of the biggest is kind of taking away humility. Are there other big takeaways that you have for the neuropsychologist that will be listening to your talk at the symposium?
Yeah, I mean, I think that the humility is probably the main one, and I think that with that, embracing that our education has a shelf life, and that our education around cultural psychology and a sociocultural lens has been woefully inadequate. And then what are you going to do about that? How are you going to change that? How are you going to continue to be a lifelong learner with that? And then I think, the other main thing is just, can you allow yourself to be in a space where you're looking at things that are uncomfortable, and looking at ways that your privilege maybe has contributed to some of the systemic stuff that there's calls to be decolonized? And can you sit in that space long enough that the uncomfortability, um, moves beyond defensiveness and moves towards change and moves towards action and accountability. And that's, I think, where the rubber's going to hit the road for a lot of people. I think some people will be able to have that capacity, and others will find reasons, and they'll start getting focused on tone policing and how things were said. And there's all these, if you understand or look up microaggressions, all these microaggressions will emerge as a way to not have to be introspective.
Yeah, there's a lot to unpack there, and I'm so excited for all of us to get to learn more from your talk at the symposium. It'll be this May, and for those of you who are listening, you can read more about the conference and register to attend and hear Dr. Caze's talk and the SNS website. It is the sportsneuropsychologysociety.com, and you can also follow SNS on Facebook and on Twitter to learn more. Thanks, Dr. Caze.
All right. Thank you. Soon to be Dr. Bouchard.